Leg pain while walking, don't ignore these signs. Hi, I'm Dr. Arun Kumar, Vascular and Endovascular Surgeon at Aster RV Hospital, JP Nagar. Do you experience pain when you walk a certain distance and it relieves at taking rest? You experience something called as claudication. In much more severe form, when there is blackening of toes, when there is a non-healing ulcer in the leg, and even if you experience pain at rest, it is called as critical limb ischemia. These above two scenarios which I explained is part of something called as peripheral vascular disease. What is happening in your blood vessels? These blood vessels are like highways in your body which carries oxygen rich blood supply. Over a period of time, when you have unhealthy habits such as smoking, have uncontrolled hypertension, diabetes and high cholesterol, there is some fat deposition inside your blood vessels causing plaques. When these plaques form, which narrows the blood supply, which leads to something called as claudication, that is pain when you experience while walking and relieves at rest. When these plaques become bigger and bigger and it causes much severe blockages, can cause critical reduction of blood supply to your muscles, which can lead to something called as critical limb threatening ischemia. That is when you experience pain at rest and develop ulcers or wounds in the leg and develop any gangrenes. As you can see, when there is reduced blood supply to the leg, it can lead to gangrenes and lead to major amputations in the leg. Also, you have to remember, if you have blockages in your peripheral blood vessels, it can also mean that you can have blockages in your blood vessels going to the brain and in the heart, can have high risk of having stroke or a heart attack. Who is at risk? Patients who have uncontrolled diabetes, uncontrolled hypertension, who have uncontrolled cholesterol levels in the body, who have been a smoker or a past smoker. These are the patients who have to be wary of the situation. What are the red flags? Like we already have discussed, the patient who have experienced pain on walking a certain short distance, and patients who have toe wounds, gangrenes, ulcers which are not healing, and who experience pain at rest are the patients who should consult a vascular surgeon at the earliest. What do you have to do today? You have to quit smoking. That is the single most important factor. Then you should control your diabetes, hypertension and your cholesterol levels strictly. And to patients who experience this kind of symptoms, can undergo interventions such as angioplasty, stenting and bypass, which can improve the blood flow to the leg and prevent you from having major amputations. Finally, your legs are meant to carry you forward, not to hold you back. I am Dr. Arun Kumar. Stay active, stay healthy. Watch for what your legs are trying to tell you. Thank you.